Hello, Dr. Robin here, and today I want to talk about calcium. Now, calcium is the most abundant mineral in our body. With that, it does help with building and maintaining bones. Oftentimes, people will get diagnosis with osteopenia or osteoporosis and be recommended calcium. So I get asked that often, should I take calcium and which form of calcium should I use? So great question, and today I want to answer that question. One, calcium is one that we can check in blood, which is great. We look at different ranges from a functional range from conventional range. So oftentimes I'll look at that narrowed range to see if someone's on the higher end or the lower end. But to be honest, when we look at calcium, the biggest thing I see from a functional medicine standpoint is that most people are not deficient in calcium, but deficient in their body's ability to absorb and digest calcium. So calcium is one that needs acid in order to digest. Now this one I find it kind of funny because if you look at most of the calcium supplements that are out there, the cheapest form of calcium to make is calcium carbonate. So if you do have calcium and you're taking it home, go look at your bottle right now and see what it is. If it's calcium carbonate, this is one that is made out of limestone. So it's easy and cheap to produce, but also if you don't have acid in your stomach, your body cannot break it down. Since it can't break it down, it can go to the arteries, and there is research showing that calcium carbonate can cause heart attack or stroke. Because of that, anybody that has calcium carbonate, I do recommend that you take it and just ditch it and throw it out because we don't need that, and I don't recommend that one for anybody. So that's a cheap form of calcium that we don't want to use. Now, if you are having issues where you've been recommended calcium and you come to me for functional medicine, I likely, looking at your symptoms, will want to look a little bit more deeper into what we call a GI stool test or a MAP test to make sure digestion is working well, or I'll do some tests first to see if your body has enough stomach acid. So betaine HCl is a digestive enzyme. Acid support that we use that helps your body break down and get the nutrients from the food that you eat. And I purposely, and for most people, I recommend getting the calcium from their food as opposed to needing to take it from supplements. When we take too much from supplements, that also can put you at risk for kidney stones. And for those of you that have past kidney stones, I know you don't wish it on anybody because it is very painful. So that's one we very want to be cautious with as well. So if you're thinking about calcium, we can come consult, look at your situation and what you have going on. Now, if you are using calcium or have some good brands, there's only a couple instances that I use. If someone is diagnosed with the osteoporosis, and that's the bone wearing away, obviously remember there's what's called Wolff's principle, which means the bone has the ability to increase in density according to the stress placed on it. So that's where I'm a big fan of exercise and movement. That's how we're going to strengthen our bones. But if we are low and we're worried about it, that's where this is my favorite support from Metagenics. It's called Bone Builder. It does have a good bioavailable form of calcium, which is combined with phosphorus together. And this one will help your body with building and supporting the bone. So that's one of the most common ones if we're working on building bone. Now, the other reason that I will use calcium does help with relaxation of some of the muscles, so it can help with headaches, can help with cramping. And I first started using this one. This is our magnesium lactate. For any women out there who do have the menstrual cycle with very heavy cramping and you're just in pain and kind of crumped over, that's how I used to be till I found this one. And so at the beginning of my cycle, I always have this one on hand and I take it and I don't have any more cramping or pain. So it's a nice one that will help with kind of the intense muscle cramping, and that's why I recommend. This is calcium lactate form. The thing I like about Standard Process is they actually did the research and they looked at the ratio from calcium to magnesium in the body, and they looked at it's about 5-to-1. And so oftentimes when people take calcium, then they become deficient in magnesium because those work together synergistically. So this has together your calcium lactate and does add a little bit of the magnesium in it as well. So you find that balance in the body. So that's our calcium lactate. Calcium also is great for the immune system, and that's the other one I will use this for. If somebody has a chronic viral infection or even something like herpes simplex virus, as opposed to needing medications long-term that depress our immune system, This helps build up and supports your immune system so that you can wear off any kind of bacterial or viruses. And that's our calcium lactate.